Welcome back, and thank you so much for staying with us. We're talking suicide with our special guest, Dr. Helen Clark, child and adolescent psychiatrist, Mr. Nkini Phasha, who's board member of SADC, and in our Cape Town studio, Nicole Jennings, spokesperson for Pharma Dynamics. Now, before we start our discussion, let's take another anonymous from Johannesburg. Anonymous, welcome. Anonymous, are you there?
Good afternoon, can you hear me?
Yes, we can. Go ahead.
I'm a cancer patient. I'm on stage 4. And I look like a swollen woman that's giving birth any time now. I just feel everything is just turning around me that I don't want to go on chemotherapy anymore. I would like them to do an operation, but they say to me it's super dangerous. But I mean, I can't be walking like this for almost 2 years. So I'm just looking at all my tablets and everything, because January I'll be back in hospital again doing chemotherapy. So I feel I need help because it just can't go on like this.
Okay. Anonymous, please, we urge you to just hold on. Just stay there. We're going to come back to you, and somebody will be in touch with you immediately. Okay. Dr. Clark, let's come back to our discussion in terms of just trying to understand who's at risk. I know we've touched on bits and pieces of this, but let's just try and unpack it further now, looking at the common risk factors for suicide.
I think it's fairly obvious that people who are suffering from depression and anxiety would obviously be at risk. The presentation of severe depression, severe anxiety places you at risk for suicide. One of the things that a lot of people don't realize is that quite a lot of the time, suicide is an impulsive gesture, not necessarily associated with a sustained pattern of depression, and often it's just the culmination of a lot of stresses that have been occurring in your life. And we find this very commonly with our adolescents, that they're just carrying a lot of things that have been going on in their lives. They are coming from backgrounds where there is a lot of stress. There may be family conflict, domestic violence, there may be histories of abuse. A lot of our kids, when they come into us, they've had histories of sexual abuse. There's chaos in their families. Families have disintegrated, fallen apart. We see problems with where there's been divorce, where children are stuck in the middle of divorce. And what happens is you've got these very stressed kids who are then just... one little thing happens, one thing more happens, and the whole thing blows. So it's basically the lifestyle that our children and adolescents and adults are following. And then one little thing happens, and the whole thing boils over.
Nkini, I'm going to come back to you because I'd like us to talk a little more about, family dynamics. But I need to just go across to Cape Town and speak to Nicole. Nicole, I do know that, in our discussion you said something about, you having a program called, is it Let's Talk? Just tell us a little bit more about that.
Yes, that's right. So the Let's Talk platform is an online platform, and it's a bit of an intervention because for a lot of people it's not easily accessible to go to a registered psychiatrist, for example. In fact, there's only one registered psychiatrist available for every 100,000 South Africans that struggle with mental illness. And so the Let's Talk platform is basically there for people to share their stories, for a community to exist between people that struggle with mental illness. We've also got some lovely recipes there. There is some evidence that suggests that a certain lifestyle changes, and specifically diet, can have a mood-boosting effect. I just want to mention there that that is in no way a replacement for medication, but it is important to take care of a diet and to make sure that you follow a healthy lifestyle for depression. And then just to add, when it comes to the risk factors, in South Africa specifically, when we look at young people, students for example, Not only do our students have to deal with general stresses that are associated with exams, but they also have protests on campus, victimization. We are in a situation, unfortunately, where there are so many other factors that add to the trauma and the stress of young people. And that's why it's so important for people to be able to talk about it, for people to support each other and to create a community for people who struggle with mental illness.
And especially around this time when we're looking at exams, hey? So let's take, I believe we have another Anonymous, this time from Cape Town. Anonymous, welcome to Health Talk.
Good afternoon.
Good afternoon.
I've just spoken to one of the consultants explaining to them about my situation. 7 times I've tried to commit suicide, first at the age of 9. Recently was a month ago when my dad was sick and in hospital. They sent me to a mental hospital, and I was let out on Friday, and just 2 hours later it passed. It's so hard to process my mind, and at work I'm not coping, so I decided to quit my job today. At this stage, I don't know what to do. I find myself just bursting out in tears. I get anxiety attacks nowadays. I see a therapist. I see a psychiatrist. I'm on medication, but nothing seems to be helping.
Okay. Anonymous, Anonymous, all I can say to you is that suicide is definitely not the answer, but I urge you to please just stay tuned. Someone is going to come to you now and speak to you immediately and try and see if we can get some help to you. Right, do you want to comment on that, Nkini?
I mean, certainly, it really does sound like there is a lot of underlying, depression, life, traumatic, experiences. And of course, we know that there is a very strong link between depression, and suicide. So really, I think, as we said, that, Anonymous, please, our producer is going to get in touch with you. There is help. You don't have to actually walk through this path alone. There are alternatives, and we'll be able to definitely help you. And also, remember with medication as well, it could be that the dose that, she's on is not effective enough, or even the option, whether it's an antidepressant or it's an anxiolytic. Yeah. So we may need to look at whether, changing and tweaking the therapy that she is on, but also a combination of medication as well as psychotherapy has been proven globally to be quite effective in, managing and treating, these kind of conditions.
Yeah. Just quickly, Nicole, back in Cape Town, your last word, because I think, look, we're getting all these calls. Clearly, this is a problem. Your last few words?
Yes, so if I can just finish off by saying that I think with depression still being so stigmatized in the country, it's important to understand that it is a real disease as any other disease, such as heart disease, for example, and there really is no shame in speaking up and in seeking help if you do feel that you are struggling with a mental illness. So if I can just give the URL for the intervention, Let's Talk, it's www.letstalkmh.co.za, where people can share their story. We also sponsor one of the SADAG helplines, and we have got the number available there on the website. There's also some lovely webinars from trained psychiatrists, just giving patients advice on some of the general mental conditions. And then there's an opportunity to share your story and to get some support and interact with other people in a similar situation. All
right. Okay. Nicole Jennings, spokesperson from Pharmadynamics, thank you so much for your time. All right, time for another quick commercial break. When we come back, we now talk about, how do we treat and support those people affected by suicide in one way or the other. Please stay with us.
The richness of Frisco with the creaminess of Ellis Brown make the perfect cup of coffee, because some things just go better together. Buy any participating Frisco or Ellis Brown pack and you could win your share of 1 million rand in airtime, including two 50,000 rand cash prizes. Frisco and Ellis Brown, better together.
Introducing new Sunlight with smart foam technology with the fragrance you love, but foam that now washes away in up to half the rinsing.